endometrium, that is pachan of the endometrium is much more important. So in the Grahani, we also check that the typical Navaraja, Prasadaraja and Purana-raja, this Pachana is also impacted by the Shoshaman Vanni in the Grahani. So if Grahani is not working properly, Grahani Vyadhi is present in the patients, then the typical this conversion from Navaraja to Prasadaraja and Prasadaraja to Purana-raja is not occurring properly, and for that the medicines from Grahani also we use for the patients having infertility. So, which medications from Grahani are used? Typically, the Bilvavaleha is the main medicine we use in the patients having Grahani. Under Bilvavaleha, generally patients are having Krutepya Kruta Saunyata. That thing is recovered with the Bilvavaleha. Again, the Krutepya Kruta Saunyata we can see in the angle of bleeding also. So, some patients are having menses irregularly, or the patients are having the menses like 3-4 days bleeding, again the bleeding stops and again bleeding starts. Like those things, we can consider the sthana bheda se grahani in the garbhashay, and for that matter we give the bilvavaleha in the patients. Also the snehan, that is grahani mihir tel for application all over the body, because vata is the main vitiated in the Vataja Grahani, and so for application all over the body, that is Sarvanga Snehan, the Grahani Mihir Tel is given. Also, Grahani Kapata Ras, that is also given to the patients having Grahani and infertility. So these are the main points of the Grahani. Again, the Pandu. Pandu generally we think in the anemic conditions. Like in Vataja Pandu, Gruddhis Sarva Rasananja. This is the main lakshan of the Pandu. And the patients having Pandu show the symptoms like Daurbalya, उत्साह नहीं रहता है उनमें, लॉस ऑफ लिबिडो, एंड पांडु राजा, from that which the name Roga Pandu is derived, was also having the same problem of infertility, and because of that he was not able to give her Rani the baby like that. So Pandu is the main cause of the infertility, and for this Pandu the Dadimavaleha acts wonderfully in the patients having Pandu and patients having infertility. So Dadimavaleha. Secondly, Navas Lohi is also given to the patients having these Lakshana like Pandu and Grahani. Also the patients having Arsha are considered for this infertility. So you will be thinking, what is the role of Arsha in this infertility? So Arsha is in area of Apana Kshetra, that is Apana Vayu ke Kshetra mein aata hai, और infertility, that is the fertile या त्रैवर्ता योनि, वो भी जो है वो अपान के क्षेत्र में आती है. So both are in अपान क्षेत्र, both are having वात typically वाता विकृति, and जो त्रैवर्ता योनि व्यापक जो है वो भी सब वात की विकृति से ही होते हैं. नहीं वाताद्रुते योनि नारी नाम संप्रदोष्यति इट इज स्टेटेड. सो वात विकृति और सब जो योनि व्यापद है, those are resulted into infertility. योनि व्यापद का जो result है, that is infertility. So Arsha is also considered, and for that Arsha Kuthar. Secondly, Arsha's formula, that is Dhanyak Dipya Kushir Haritaki, those are given to the patients. Secondly, the endometrial polyps and cervical polyps, like those things we have also stated in the Arsha. And one more thing, whenever there are abortions, multiple abortions, or patient is having threatened an abortion, it should be treated like Rakta Jarsa, it is stated that. So patients which are having threatened an abortion, कि just spotting हुआ है अभी, पेशेंट को पूरा लाइट डाउन करना है, उसको पूरा हेडलो देना है, बेड पैन रेस्ट देना है, and after that we have to give the medications from Rakta Jarsa. That is Dhanyak Dipya Kushir Haritaki, Kadimavalehi is to be given. Durvagruta is to be applied on the lower abdomen continuously for 24 hours. Every 3 hourly it should be repeated. Third thing, Nasya is given to the patients having these threatened and abortions. The Nasya of Swarasa of Dadima Pushpa, which is stated in Arsha is given to the patients having threatened abortions, and because of all these medications, the patient with threatened abortion is able to carry the baby for long term and carry the baby for complete 9 months, and the baby with normal weight and all these things comes in hand with of the patient. So these are some different types of or different ailments we have to think in the view of this infertility. So some more cases I want to present over here. The case of low AMH, normally in nowadays, AMH is the main culprit for having the conception. हमेशा when the patient is infertile age, the AMH is at 50%, because if 100 ml, we can just consider 100 ml, then it is continuously depleting, and at fertile age it is 40%, and when the patient wants to conceive, that is over 25%. इतना ही कम रहता है, और that time patient is trying to get conceived. In that case, AMH generally बढ़ता नहीं है, ऐसे कहा जाता है, right? लेकिन AMH to be considered and other angles like Agada chikits has to be given to the patients having a low AMH and the patients having infertility because of the low AMH. In this case, just screenshot is डाला है इसमें, देखिए आप. So patient was having hepatitis B also positive, rubella also positive, and was having AMH 1.3. And the 2nd January and 6th June, then that is after 6 months, she was having 5.3. Generally AMH बढ़ता नहीं है, ऐसे कहा जाता है, लेकिन we have the reports like this. So in this case, Doshi Vishari and Mukti Kamduda was used for the patient with having low AMH. So why this AMH is depleting so fast? ऐसे अगर सोचते हैं तो शरीर में जो अगद यानी विषाक्तता जो है, उसके कारण ये डिप्लेशन जल्दी हो जाता है. So samata, and this samata is converted to the दूषी विष in our body. So अगद तंत्र जो है, जो वाग्भट के जो अगद के जो अध्याय है, उसमें से जो दूषी विषारी अगद है, that we use for low AMH. Secondly, Prajasapan Gruta was given. So Prajasapan, I have already explained why it is given in the patients. So Yograj Gugul and Trayodashang Gugul, these are the two Gugulus which are having फलश्रुति as fertility बढ़ाता है, या फिर वृक्ष ऐसा उसका फलश्रुति है, इसके लिए वो भी यूज किया था. और फिर ये जो पेशेंट है वो was conceived, and secondly she is having a child in her hand now. Again, one more case I want to state over here, that is the Sarvadahi Kshetra, that we can we have to consider Sarvadahi Kshetra, then पूरा body जो है उसका विचार करना चाहिए. So the patients with hypothyroidism are nowadays very much increasing, and because of that, because of the thyroid levels, because of the hypothyroidism, the patients are not able to conceive, or if the patient get conceives, then also abortions are there, or till term pregnancy nahi jata hai, like those things happen. So TSH should be in normal, within normal range. For those things, what we give to the patients are generally Punanava Gugul, Punanav Mandur, Kanchanar Gugul. Kanchanar already having Gandamala Nashak, Punanava Shothagna hai. So because of that, when the Punanava is given, the overall edematous body, the swelled up body because of the thyroid reduces, and because of that Punanava is given to the patients having hypothyroidism. Secondly, Medopachak is also given to the patients having hypothyroidism, because in the thyroidism there is metabolic changes of fat in the body, and because of that Medopachak is to be given in the patients having hypothyroidism. Amra Haridra is very much important, and Amra Haridra जो है उसका लेप लगाने के लिए दिया जाता है on the area of the neck or on the area of the throat for this hypothyroidism. Why this leap is given to the patients? Gala, that is throat, is called as Raktashay and Rakta Vikruti, and because of that the infertility is there because of the hypothyroidism. And so for this hypothyroidism, Punanava and Amraharidra application is given on the throat, that is on the area of the thyroid, and the patients are having the reports normal for the TSH. So patient was having TSH 35 in the May, and 0.56 or 46 was there in the, these are the reports of the patients. The TSH before was having 35. No other medication was given, and TSH after the treatment was 0.569. So these are the reports of the patients, and these are the medications given to the patient. So these are the main important things we have to think, because nowadays the patients with hypothyroidism and patients with infertility are more. So because of that, these things to be considered. Nowadays, many a times it happens that IVF failures, multiple IVF failures are there, and the patients reach to our clinic to undergo panchakarma, and after that they want to go for IVF. Then you will be thinking, why IVF? Why not natural conception? Because sometimes it happens that because some elements like hydrosulfings or tubal block or tubal infections, they have cut their tubes, so there is no hope of getting conception naturally. लेकिन फिर भी उनको कंसीव करना है एंड मल्टीपल आईवीएफ फेल्योर अगर है, तो ऐसे जो पेशेंट्स है ना, वो हमारे क्लिनिक में आ जाते हैं कि यस वी वांट टू गेट डन ऑल द पंचकर्म फर्स्ट एंड आफ्टर दैट विल बी प्लानिंग फॉर आईवीएफ. In those cases also, we provide the treatment, and generally with the medication and with the panchakarma, the patient is able to uh, conceive with the IVF successfully. So in these cases, what medication is to be given, that is Vayasthapan, that I have already told you that biological age of the patient and the biological age of the uterus should be fertile, and so for that thing Vayasthapan Gan is given, Purana Malashuddhi is given. Again, the Parushaka Vatadi Gan is stated in the टिपिकली वाग्भटा, परुषक वटादिभ्याम क्षीणे शुक्र करिक्रिया. परुषकादि गण और वटादि गण ये जो है वो देने चाहिए किसमें, तो क्षीण शुक्र जिसमें है उसमें वो देने चाहिए. सो वटादि गण इंक्लूड्स ऑल द पंचक्षीरी वृक्ष, और परुषक एंड परुषक वराद्राक्षा कटफलम कतकात्फलम, दैट those medications are stated in the अध्याय 15 सूत्रस्थान. So Parushakadigan and Vatadigan, that is also given to the patients having क्षीणे शुक्र करी क्रिया, ऐसे कहा गया है, शुक्र कर क्रिया उनको देनी चाहिए इसके लिए. In these patients, what the main thing we have to do is the endometrium. So the patients having tubectomy or patients undergoing this IVF procedures, the endometrium is the main culprit where the patients are not able to conceive and grow the baby. So for that matter, Parushakati and Vatatigan helps. Secondly, Vidaryadigan Basti are also given to the patients, that is the Kshirapak Basti given to the patients having typically endometrial thinness, that is endometrium is not growing, that is not tri-layered, that is not spongy, that is not rich with blood supply, and these are the main causes of the IVF failure. So to increase the blood supply of the endometrium, to increase the thickness of the endometrium, to increase the tri-layered and spongy nature of the endometrium, Vidaryadi Gana Kshirapak also helps to the patient for these elements. So thin endometrium या फिर endometrium का thickness नहीं बढ़ रहा है, because of the patient is not able to conceive with IVF, in those cases Vidaryadi Gan also important. So these are some medications we generally use in our clinic for conception by IVF or by natural way. So secondly, in IVF patients also, the lower abdominal lip are also important. Vrusha lip, that is Chandana Ushira, those are also important, and those are given on the application on the lower abdomen. So एक सूत्र है कि बाह्यांत उपयोजयेत उपचार प्रियहितैर्भर्त्रा भृतैश्च गर्भदृक्. अभ्यंतर और बाह्य उपचार both are important in point of fertility. Why this is so? Because when we apply any medication on the skin all over the body, so that is a sthana of vayu. So snehana is important for vitiated vata dosha. So all over body, Snehana is given to the patient. So vitiated Vata dosha gets stabilized, get normalized, and because of that, the Travarta yoni also, which is in the kshetra of Apan, activates and get ready to get conceived. Secondly, वृषगण जो है उसके लेप जो है वो लोअर एब्डोमेन के ऊपर लगाने के लिए देने हैं जब भी आईवीएफ के प्रोसीजर्स है. Secondly, some patients are having typical breast heaviness, breast engorgement, and irregular menses. In those cases also, prolactin levels are raised. We see the reports like raised prolactin levels. In those cases also, the lap on breast are important. So in those cases, Chandana Ushira जो लेप है वो has to be applied on the breast, and so that it impacts the uterus also, and अधोगामित्व of the raja is there, and so patient is able to get conceived. And raja क्षीणता या फिर जो थिन एंडोमेट्रियम है, those reports जो है वो नॉर्मल में आ जाने के लिए मदद हो जाती है. So for that thing, the breast applications are also more important. So अलग अलग जो routes of administration of drug है, those we have to try in the fertility cases, like nasya, like basti, like skin applications on lower abdomen, applications of this thing breast, and naval medicines are also given, like Vishwatel or Balatel, for normalize the vitiated Vata dosha. So these are the some cases, and these are the some points which I have to focus for infertility and Ayurveda. So thank you so much for patient listening, and we are having detailed lectures on our YouTube channel also. You can follow this YouTube channel also to get connected and listen to the other lectures like infertility, and also thank you one and all. If time permits, I request Dr. Bal to go further for discussion or question answer session.
Yeah, sure, ma'am. Thank you very much, ma'am. Your voice is very, very sweet, ma'am. And also, we don't know how the time passed. It was a very nice experience to hear you. It was just like we were listening.
Today was the
Saraswati Ma.
best academic feast, I think, for all. Yeah.
Yeah.
Yes.
Thank you
Thank
very
you,
much, ma'am.
Thank you so much, ma'am. It was a wonderful session. Carry on, Ajay.
Yeah, if there are few questions from the audience, I would like
Okay.
to discuss with ma'am.
Okay.
Ma'am, you stated millet for female. So is it applicable for male also?
Yes, it is applicable for male also.
Okay.
I want to tell the story. One story of not doctor, sorry, Dilip Raja. So he was having infertility, and his guru told him to काय बोलतात सेवा करने of गाय, काऊ की जो है वो उसकी सेवा करने के लिए बोली है. So in that case, Raja was there and he was having luxurious life, and because of that Santarpanjanya Medovruddhi was there, and when he used to take care of the cows, he have to run behind the cows, and because of that his age reduced, and he was able to conceive. And just in this also, the metabolism of fat is also important, and that affects the fertility. So millets are also having effect on typically fat metabolism, because generally wheat is more nutritious, and that has to be given, not that is not a question. But millets like jawar, like bajra, those are laghu dhanya, that those are truna dhanya, and because of that what happens ki it helps to reduce the weight, or it helps to manage the weight, and some of them are antioxidants also. So in male and female both, jawar, bajra, these should be taken while the patient is willing for conception or pregnancy.
Thank you, ma'am. There is one question we all are eager to know about the Valmik Raja.
Acha. Okay, Valmika Raja is anthill methi, we can call it, and that has to be Sangrahan Kal is typical Sangrahan Kal, that is just after Nag Panchami, that is in Shravan Mas, that is to be collected. That has to be fortified with the Vidanga Kvat Bhavana for 21 number or 21 days, and that has to be used in the patients having infertility or having genetic abnormalities. So we are using since last 20 years, and we are happy to share with you that the patients having previous abnormal baby, but those patients having treatment at our Shri Rukma Chikitsalaya with this Valmikaraja are having normal babies after the medication and all these things. So Valmikaraja and Swarna Malini Vasanta and Prajastapangan, this is the thing we are using for genetic abnormal, previous genetic abnormalities in the babies. Yes.
Very nice, ma'am. Great. Ma'am, is the chocolate cyst are treatable with Ayurveda?
Yeah. In chocolate cyst, we see that there is hemorrhage and cyst, right? So
Yes, ma'am.
for hemorrhage, we have to give the Rakta Prasadan and Shonita Sthapangan. So Rakta Prasadan is done with the medications like Rakta Pajak Mauktik Kanduda, then Rakta Pitta Kulakandandras, then Durvaghruta. All these medications are used. Secondly, some application on the lower abdomen is to be given, like to dissolve those cysts, those which are chocolate cysts. So one, the reabsorption of the hemorrhage over there, and cyst जो है उसको निकालना चाहिए, इसके लिए उसका पाचन होना है. So like these things, the Putra Potalis is also, and some medications like Rakta Prasadan, we have patients having chocolate.
Yes, ma'am. Thank you very much, ma'am. Ma'am, can you please explain something about unexplained infertility to us?
Yeah. दैवम चैवात्र पंचमम इति सूत्र है कि जिसमें कहा गया है कि अनएक्सप्लेन इनफर्टिलिटी की जिसका कोई भी कारण नहीं है उसका दैव कारण है. ये एक है. दैव की बदलना कैसी है गति, दैवम अपि अति वर्तते, ऐसा भी ये श्लोक आया है कि जिसमें ये भी गति हम चेंज कर सकते हैं. बिकॉज ऑफ द विटेटेड वात दोष जनरली वी सी दीज थिंग्स कि अनएक्सप्लेन इनफर्टिलिटी. So generally we considered in focus of rasa dhatu, in focus of rajo, in focus of bija, in focus of artava, but we never think in direction of vata dosha, and we never think in direction of agada tantra. So these are the two things which we have to lighten up, focus on those things for unexplained infertility. So vata vyadhi, the medicines in the Vata Vyadhi also having Falashruti as Vandhanam Putrada. So medicines having in the Vata Vyadhi like Narayan Tel, Mahanarayan Tel, Bruhatvacchintamani, like those things should be used in the cases of unexplained infertility. Moreover, the Agata Tantra medicine should also be used in the unexplained infertility. Like I have stated one medication like Doshi Vishari Agada over here. So in our changed lifestyle, number of intoxications are there. So like in the morning time, we just brush our teeth. From there only we start the introduction of chemicals in our body, right? So whenever we are consuming any vegetables, whenever we are consuming any fruits, those are also with insecticides and pesticides. So with all these things, that has an impact on the fertility. Why this is so? So one thing I wish to enlighten that कि जो विषय है, this विषय is having opposite properties on from oja, correctly reverse properties on oja. Oja, what is oja? That is तेज ओजस्तु तेजो धातु नाम शुक्रांतान परम श्रुतम. सो रस से शुक्र तक का जो तेज है उसका जो बेस्ट है, that is oja, and oj is altogether having viruddha properties from this visha, and we are consuming number of these intoxications. So we have to give agada tantra medicines for these patients with unexplained infertility. So there are a number of medications like champakadi agad for षटपद दंश, पुष्पाद नखदंश agad, या फिर this हिंदुशी विषारी agad, सर्व विषनाशक वादो बिलवादी गुलिका. all these medications should be used in unexplained infertility.
Okay, ma'am. Thank you. Thank you very much. Ma'am, you have stated Haridra to drink in PCOS patients. So, for how much days and how much quantity we have to administer the Haridra?
Right. Nowadays, the extractions of Haridra, pre-packed medications are also used. Raw, that is in powder form, Haridra can also be given. But only one thing I want to state over here is generally we use turmeric powder, but that turmeric is चुन्याच्या पाण्यामध्ये त्याला शिजवलेलं असतं. That has boiled with the this चूर्णोदक. So that turmeric powder should not be used. Then what should be used? So the ardra turmeric, that is oli halad, that we should bring. We should grate it and make the powder, and after that, that should be used. So it is having more impact on the this fat metabolism. So dry turmeric powder, which we get in market, that should not be consumed, but only that should be consumed. So
Okay.
Mehesh Dhatri Nishe, it is stated that is the Agriya Sangraha medicine. But if we use this Dhatri and Nisha in the patients having sugars or diabetes, or लेकिन sugar level drop नहीं होता है, so we think अरे ये बताया है हो नहीं रहा है, so why this is so? So we are not using the oli halad, we are using that bazaru यानी turmeric powder, which is available in the market, which is fortified and processed. So that should not be given. So only halad should be given in these cases. And the dose you have asked, the dose is we can give 2 to 3 milligram in the morning, 2 to 3 milligram in the evening. With milk, this dose is enough. Okay.
Yes, ma'am. Thank you very much, ma'am. There are a lot of questions about so many things I would like to ask about Bija Janan and Subuddhi Vardak.
Okay. Bija Janan is a formation of medicine which includes Shatavari, Guduchi Sattva, Shankha, and Ananta. And we are using in our clinic in many patients. And this is having a good effect for ovulation and Bija Shuddhi. And Subuddhi Vardak medicine, this is the चार जो मेद्य रसायन है, that is blended with the same decoction of the Chatu Medya Rasayan. And one thing I wish to state over here, that the Rasayan impact is Dirgham Ayu Smruti Medha Arogyam Tarunam Vayaha. That Smruti part is there. So I think ऐसा हम हाइपोथेटिकल सोच भी सकते हैं कि डीएनए का जो स्ट्रक्चरिंग होता है, सो उसमें जो स्मृति है कि टिपिकल वही स्ट्रक्चरिंग करना है, ऐसा जो भी रहता है ना दैट टाइम में, जेनेटिक एबनॉर्मलिटी अगर नहीं आनी है तो टिपिकल वो डीएनए स्ट्रक्चरिंग होना चाहिए. सो उसमें वो स्मृति इंपॉर्टेंट रहती है. सो इसी के लिए चार मेद्य रसायन जो बोले हैं ना, वो यूज किए जाते हैं सुबुद्धि में.
ओके मैम, थैंक यू वेरी मच मैम. मैम, आपने वमन विरेचन जो शरीर शुद्धि के बारे में बताया है, उसके बाद में बस्ती के लिए आपने बताया, तो उत्तर बस्ती आपने अच्छे से एलिब्रेट किया है मैडम, लेकिन हम जो बस्ती दे सकते हैं या योग बस्ती दे सकते हैं, उसके बारे में आप कुछ बताना चाहेंगे?
हाँ, सर्वसमावेशक ऐसा जो बस्ती है ना, वो है दशमूल धन्वंतर, कैन बी गिवन इन द एनी पेशेंट ऑफ इनफर्टिलिटी. Secondly, if the patient is having irregular menses or delayed menses or having a low amount of bleeding, then Dashamul and Sahchar Tel Basti is given. If the patient is having delay of menses like 40 more than 45 days, more than 2 months, more than 3 months, and onset of menses is to be expected by the doctor, ऐसा अगर है, so for induction of the menses we generally give Shukranila Vibandeshu plus Shatavadi Baste. So these are the bastis given. And for infertility and patients having regular menses, generally Kshiropak basti is given, that is Shatavari, Guduchi, Kshiropak and Falagruta added to the basti. So Kshiropak basti 120 ml plus Gruta जो है वो 20 to 30 ml max we use. Deshabha is the same. So if I am practicing at Pune, then 30 ml is also given. But in Mumbai, सामता बहुत जल्दी आ जाते हैं, इसके लिए 20 ml तक ही दिया जाता है.
Okay, ma'am. Thank you very much, ma'am.
Ma'am, just one question
Yeah.
from my side.
Okay.
In the cases of severe endometriosis after operative, when we take these patients for the induction,
Yeah.
how you decide your protocol for yoga basti and then uttar basti?
Okay. Generally, the patients having this endometriosis, you said, right? So, in the endometriosis, रक्त प्रसादन बस्ती are given and रक्त पाचक जो योग है धातु पाचक में, so that path is given to the basti to the patient, and in that the oils generally blended with यानी सस्नेह निर्व बस्ती, like those things we generally use. सो टिपिकली रक्तपाचक काढ़ा प्लस जो सहचर तेल या फिर बला तेल, these things are mixed up and given to the patient. टिपिकल योग बसेने व्यत्यासात जो निरु अनुवासन जो है ना, like those things we not use in the fertility patients with having endometriosis.
Okay, ma'am.
Okay, ma'am.
Madam, what can we advise for recurrent preterm labor?
Okay. Mainly the cause of preterm labor is vayu vikruti. Secondly, the cervix is not able to hold the pregnancy moreover. So for that, the holding capacity of cervix, that has to be considered, and for that thing, the asthi dhatu in the cervix should be considered and should be think in that direction. So for those things, we can give Mausapachak and Padmakashta, Mauktik Kanduda. And secondly, if the patient is having, say, Vyasan, any bad habits like alcohol and all these things, tobacco, those should be stopped. Pichu can also be given to the patients, but the patients having already one or two preterm labor, she is very much scared of putting anything in the vagina, so that patient should be admitted and pichu should be inserted, or otherwise guda pichu can also be given to the patients having preterm labor to avoid those preterm labors. One more thing is sometimes there are some infections in the amniotic sac, and because of that these labors occur, and for those for that things the coitus should be strictly avoided during the complete pregnancy. Secondly, the patient ahar, garbhini ahar and vihar, that should be checked for proper homemade food and all these things. And lower abdominal applications of Shatadhauta Gruta or Balatela Pichu is to be given on the lower abdomen after say 6th, 7th, 8th month. So patient can go till term and deliver a normal baby.
Okay, ma'am. Thank you very much, ma'am. One of the questions from Matangi Pandya, ma'am. What could we do in recurrent hemorrhagic cyst?
Okay. Actually, we have discussed
Yes, ma'am. Yes. In
same question.
PCOS or chocolate cyst. Yeah.
Huh.
Ma'am, another I think we have not discussed about fibroid uterus. So
Okay.
is it possible with us
Just
to having
now,
2 or 3 fibroids?
we are having cases with pregnancy and fibroid. And just now, a patient is in our Dombivli clinic with having a huge fibroid and pregnancy. She is having 11 centimeter fibroid, and her pregnancy is now say 28 weeks. So she was advised कि it will not grow till term, शायद नहीं grow because of the huge fibroid. The uterus will not getting the space for those things. So external applications are more important because internal medications for growth of baby and well-being is given. But for that fibroid, it will grow as the pregnancy progresses because of the blood supply is rich for the uterus during pregnancy time. So during pregnancy time, that growth can be restricted only with the external application. So I think so. So external applications are given. So ashwagandha, chandan and dikemali, this application leaf is given to the patients having pregnancy and fibroid. And after her parturition, that is after the labor, so patient is advised to take the proper medications for at least 3 months for regression of that fibroid. And during the involution process, during the involution period, this fibroids regress very nicely with medication. So this is the experience.
Very much thankful, ma'am. Madam, do castor oil abdominal packs have any role in endometrial receptivity?
Okay. Actually speaking, I have not used the thing. So if you are having experience, so if you are suggesting to use it, I can use in my clinic and reverse you back. But I have not
Okay.
used yeah.
This question was asked by Dr. Priya Chawla.
Okay. Okay.
Madam,
Yes, but we can
what
think in the direction of castor oil is also a Virejan thing. It will
Okay, ma'am.
act on the Rakta Dhatu, that is Shonita, that is endometrial receptivity may increase because of the castor oil. Generally, castor oil is introduced in the patients having expecting labor pains. So castor oil is also applied for the patients having expecting the labor or having we can say कि postdatism है तो just apply the castor oil and take the castor oil with this ajwain and it induces the labor pains. So this is
Yes,
having
ma'am.
impact in the uterus, but I am not having the experience of castor oil on the endometrial receptivity.
Yes, ma'am. Thank you very much, ma'am.
Madam,
Ma'am, there is one question from Dr. Abhishek Kupre. When to use Pushpa Dhanwa Ras?
Yeah. In the whole presentation, I have not used,
Pushpa Dhanwa Ras.
I
Yes,
have
ma'am.
not mentioned the Pushpadanvaras. But Pushpadanvaras, it can be given in the patients having Rasadhatu, yani Rasa Kshinata. Secondly, the patients which are having irregular menses, then patients which are irritable during menstruation. So yeah, these are the three conditions. Generally, we use Pushpadanva in the patients which are having these conditions.
Okay, ma'am. Thank you very much, ma'am.
Ma'am, generally we see in a PCOS or the obesity patients, or you can see with the hypothyroid patients, there is a luteal phase defect. In such cases, for the support, what you prefer?
Yeah. In PCOS cases, generally when luteal support is not, and generally patients turn up to say blighted ovum or anovulation, and
Implantation failure.
yeah, and generally pregnancy is not fruitful. So for
Yeah.
those things, local applications are very much important. Secondly, when the consumption of medicine is there, the milk as anupan is to be given because milk is having gamitva towards shukra, and so luteal phase correction, yeah, luteal phase defect will be corrected with the dugdha anupan. So dugdha anupan is important, I think so. Then Chandrakala Ras is also having good impact on the luteal phase defect. Secondly, the patients having
Ma'am, have you ever checked the levels after taking these medications in the blood reports so that we can firmly say, yes, these medications can increase the level up to this level, which is required for the support of implantation of that ovum, zygote, sorry.
the typical endometrial thickness, those reports I'm having, but the values of this luteal phase, those I'm not having just now, but I'll keep the record and next time I'll be able to tell you regarding
No
this.
problem. Just it was because generally what means what taste would that we require for a particular level. Means when we say
Yeah.
there is an implantation failure, we need that progesterone level up to that particular in the range, which will maintain that zygote for implantation. Sorry, I missed to say that progesterone is required up to that level. So I think whenever we apply something medication that internally we are taking medications, we can means थोड़ा सा check कर सकते हैं कि how much it carries with our significant approach.
Right. This should be record should be maintained, and afterwards I'll be able to utter like this.
Madam, medications in high prolactin.
Okay. In the lecture itself only I have stated the cases like high prolactin levels and raja urdhvagamita रहती है because of that high prolactin levels are there. So because breast weakness is there and for sore breast is there because of the high progesterone, high prolactin levels, and because of that raja adhogami karna hai, that is the key for that. So the medications which help to increase the vaginal blood flow, those are having impact on the prolactin levels. So Lata Karanja, Pipali Marich, these things we use generally for high prolactin levels. So this is the thought, or this is the process, or this is the things which we generally use in our practice.
Thank you very much, ma'am. Ma'am, you have stated Sahacharatel Basti for ovulation induction. So
Yeah.
how it is administered for how many days it is to be given?
हाँ, it is stated that सहचरः अधोभाग हरणम, यानी जो नाभि के नीचे का जो वायु है, that vitiated वायु, that is corrected with the सहचर. And if the वायु गति and उसका अमाउंट अगर प्राकृत है तो ओव्यूलेशन होगा, right? So उसी के हिसाब से this सहचर तेल is given in the basti. Generally we use dashamul decoction and सहचर तेल, सस्नेह निरो बस्ती युक्तरथ बस्ती for this induction of ovulation, because सहचर is ushna and matra basti minimum 80 ml is given. That amount may impact the ovulation. So because of that, Dashamulak Vath 120 ml and Sahachar Tel 30 ml. So this Sneha Niruha Basti is given to the patient for 7 days in the phase of say 10th to 18th day. So for that induction of ovulation.
Okay, ma'am. Thank you very much, ma'am.
Hello.
Hello.
Ajay, please take the questions. I think few people have some doubts also.
Okay, one question in chat box is mood swings during menstrual cycle. So yes, there are mood swings for many of the ladies in the menstrual cycle. So it should be considered as manasa jwar, and the medicines from jwara are given to the patients for these mood swings. And generally we say that if urination is there, so patient go to urinate and come. This is a normal natural process. If patient wants to defecate, patient go and defecate and come. This is a normal natural process. But whenever there is some vitiation or there is some defect in the process of urination, process of defecation, so there are some elements, because of that there are pain and all these things. So whenever menstrual flow is there, it should be a natural process without pain and without mood swings. But whenever there are pain and other symptoms and mood swings are there, so patient is having some ailments, and because of that this is happening. So manasa jwar is considered in these cases of having mood swings. So unmada, apasmara and jwar, these three conditions are considered having for patients having mood swings. So Unmada, Apasmat, Kalyanaka, Mahakalyanaka group are there. So those are given to the patients at the night time. Then Mahapashachik Ghrita, sometimes patient is having different schedules, like first, second shift, first shift, night shift. And in those cases, mood swings are there. So for those cases having shift duties, Mahapaishachik Ghrita is given to the patients. And again, the medication for Jwara, that is Pundravartaka Vata, and all these things are given to the patients having mood swings in the menstruation cycle. So with the medication, generally these mood subside. Okay, one question is कि पुराण पुरुष शोधन ऐसा लिखा है, पुराण पुरुष शोधन होना चाहिए. तो
अच्छा, हाँ.
पुराण मल शुद्धि, that is stated in रसायनोध्याय of संहिता. Just before he starts stating the rasayan, different rasayanas. That is हरित की नाम चूर्णानी, सेंधम आमल, ऐसा होता है. पहले ऐसा उसका एक उन्होंने ये दिया है कि if you want to color a cloth, if the cloth is dirty, it will not take up the proper color. So you have to wash that cloth, and for that washing procedure, that is the Purana Mala Shuddhi. The दोष जो मल स्वरूप है, धातुओं में जो मल है, उसको बाहर निकालने के लिए पुराण मल शुद्धि है. Okay.
Thank you very much, ma'am. I think ma'am has answered all the questions.
There are still remaining, I think.
Yeah.
Ajay, we can discuss on WhatsApp also if there are.
We are running out of time now.
Yeah. Okay.
Already, madam has given a very nice lecture. I think we should conclude.
I think all these members, they really want to hear ma'am again. And so
Sure.
there is a lot more things to learn. And today, madam, really, madam ने हमें ऐसे प्रदेश में लेके गए हैं जो आज तक हमें अवगत नहीं था, जिसके बारे में हमें जानकारी नहीं थी. तो आपके पास बहुत कुछ है मैम. हम सिंगल केस प्रेजेंटेशन के बारे में भी जानना चाहेंगे, जो इंटरेस्टिंग आपको लगे अच्छे से, और जिसमें सच में हमें अच्छे से सीखने को मिलेगा. So I would like to conclude today's session.
Ajay, she has a vast, and we have just seen a like pinch of it. So we should have second session of her. Q, ma'am, please.
Yes, sure, madam. And thank you so much for your kind words for me. Yeah.
Yes, ma'am.
We absolutely deserve a lot than what we are just saying, but definitely, ma'am, I will take your another session for our members. And it was really our pleasure that we have listened you today, and wonderful knowledge and the best academic feast we have today. Thank you so much, ma'am. Thank you for giving us that much time from your busy schedule. I know how much busy you are in your daily routine. So
yes,
thank you so much. Thank you so much.
Thank you, Gauri ma'am. Thank you, NIMA Central delegates. Thank you very much, NIMA Central OBGY team. Thank you very much, our technical team, Dr. Daga sir and all. And thank you all the participants who were present today. And we would like to hear Madam you again. Again, thank you very much. And I declare here that today's session is concluded. Have a nice day.
Thank you.
Thank you.
Thank you all.